The contribution of Cuba to global health workforce over time has been essential, mainly on healthcare delivery and medical education. Since the early 60s, they continued to staff public health facilities globally. The thrust of their assistance to the Gambia was mainly to bolster public health facilities, providing the often desperately needed doctors to even the remotest communities.
Prior to 1994, there were a total of 28 health facilities throughout the country, with only 2 being major referral hospitals, that is Bansang and Banjul.
From the word go, he made his intentions on health known, and since then a robust transformation of the sector began. At the request of President Jammeh in 1996, the first batch of Cuban doctors landed on Gambian soils.
Since the first batch of Cuban doctors arrived in the Gambia, they've been doing remarkably well in the healthcare sector. Cuban doctors have been working extremely hard to meet the healthcare needs of Gambians.
The task was perhaps enormous, but the medical collaborators poised to break new grounds on what is being hailed today as 20 years of effective and successful cooperation in health service delivery.
The July 22nd revolution had witnessed the availability of 91 health facilities, out of which 6 major hospitals, tertiary hospitals, and they're all strategically located.
Today you have doctors all over, at hospitals, major health centers, and before even at minor health centers and village clinics. That has transformed the health system in this country with a lot of gains in many aspects of healthcare delivery.
The period ushered in significant medical breakthroughs, while Banjul and Havana continued to thrive in the spirit of that bilateral cooperation. From 1996 till date, across major health facilities, the Cuban medical collaborators continue to maintain their presence, offering selfless health services to the needy.
We came here to give our service to the Gambian people, especially we work in this work. Now we are working here, try with our best effort to try to improve the health of the child, to prevent the infections and provide good care for days.
Many patients come here with RTA, some problem for orthopedic, trauma for orthopedic, abdominal problem too, so it's difficult and it's very hard. The morbidity is very high here in this hospital.
It's a beautiful experience. I like so much the Gambian people.
I'm Angela Otero. I'm working in pediatrics work. I'm feeling very fine because I feel like one family, because the relation between Gambian people and Cuban people are very nice.
We are working together, the Cuban and Gambian doctors, very good relationships. We are every day working, talking about the patients to improve our knowledge.
The reduction in maternal mortality, among other health gains at the AFPRC General Hospital in Farafenni, are linked to the coming of the Cuban medical team. Mothers like this one can only rejoice, expressing deep gratitude to Cubans after a successful delivery. A key tenet of their operation has been working closely with the locals.
Cuban doctors, they are really helpful. Their presence here have really motivated some of us, especially myself. Working with specialized doctors has really been meaningful to us in the world.
And ever since I started working with the Cubans, to be candid, they are very hardworking. They are very dedicated. very, very punctual, and highly disciplined. I love working with them.
The Cuba-Gambia Historic Cooperation is now seen by many as something that transcends way beyond garnering international diplomatic support.
They've improved the services tremendously through the visionary and the guidance of the dynamic leader, His Excellency Professor Sheikh Yahya A.D.D. Jammeh. And during that time, as I said, there were no medical practitioners on ground. It's the Cuban who were delivering all the services. And that time we refer most of our patients to the neighboring countries, but through their intervention that have dropped down significantly. And up till now they are contributing a lot to the healthcare delivery of this country, from the tertiary hospitals to the minor remotest hospital in the health center in the country.
At the Suleiman Junkum General Hospital in Buyam, tremendous progress has been made over the years. Hospital officials describe the Cuban team as very dependable partners.
Since we arrived here 2 years ago, we have performed our duty with utmost love and dedication. We work together hand in hand with the Gambia counterpart, sharing ideas for our objective is help the patient in particular and even the community in general.
The Cubans have been so hardworking, and I know a lot about the Cubans because I've been working with them since '96. Starting from Bansang, and here also is not an exception because when they here they are always committed to work, and they always are ready to deliver. Anytime you call them, they are ready to come and deliver, and that is the good side of it. We are not only seeing Gambians only, because sometimes we have also patients from the neighboring Casamance. It's a hospital that is fully operational, and we have a capacity of about 250 beds. But presently, 3/4 of the hospital is what is utilized.
27-year-old Dr. Irina Bistel, currently posted to Jarasoma Health Center, considers the mission a great fulfillment as she embarks on her first assignment from home.
My experience here has been very good because here I have the opportunity to work in every part of my specialty, like medical, pediatric, and emergency. This is very good for my career because I'm only 27 years old. This is my first travel out of my country, and I can work here doing everything for this country, for my country, and teaching also the Gambian health personnel to do better for their own people.
We have been working cordially with them. Since their presence here, they have drastically contributed to the reduction of maternal mortality, especially our laboring mothers. We have been working here as partners, but they have contributed a lot in terms of reduction of maternal, especially our referrals out. Because what used to happen was, before the inception of the gynecologists, all obstetric emergencies used to go to either Farafenni, Banjul or Bansang. But with the presence of the gynecologists now, we are really seeing a lot of those emergencies here, as a result of which we are reducing the referrals out.
At the Serekunda General Hospital and the Jammeh Foundation for Peace Hospital, the Cuban team is again quoted here for their hard work and dedication.
I'm a general surgeon here in Serekunda Hospital. I'm here for around 2 years, almost 3 years. I feel fine here because this country is very quiet. The people is good people. I work here in this hospital with good doctors, good person, and I feel happy. I feel happy to help your people here.
As a gynecologist, I have been working in this hospital more than 2 years. And my principal target in this place is to provide the best knowledge and the best attitude to their pregnancy women and to provide the best to improve the reproductive health care of the women in Gambia, principally this area. This is my second year in this place, but I just came here since 2012, and I have been living here like my country, because I feel that the Gambia people, they are friendly. The Gambia people used to help us in anything, and at the same time receiving a good smiling from my patient anytime I do anything to help them.
Specialized in general comprehensive doctor. I'm working here in the Gambia 4 years ago. Yeah, in the different region, and now I'm working here in the Jammu Foundation Hospital. I think the cooperation between Cuban doctors here in the country has been a blessedness for the Gambian people and the Minister of Health too, because we contribute every day for the improvement the population in the country, and I'm seeing a lot of patients every day.
It has been a great experience for me to work here in Gambia, because I have faced in a new culture, a new costume, and even local language.
The coming of the Cubans was a very big boost to the health system, because at that time we even have Cubans at primary healthcare levels, village levels, remote villages. You have Cuban doctors' presence there. At that point in time, you wouldn't have Gambian doctors who were ready to work in such remote villages. Under those circumstances, you had Cuban doctors in every small village in the Gambia at that time. Personally, our first set of Cubans were received here in 2002. That was when this hospital was born. We had 10 Cuban doctors working here. Then we were even working as in a small way, because we were not fully open. But we had 10 Cuban doctors here at that time. So I think the impact of the Cubans' presence at the JFP at that time was felt by every member of this community.
They have been very instrumental, and they have influenced our health sector positively. Over the years, we have been privileged to have Cuban medical doctors and consultants in different areas come to our country, and this has helped to improve the health system in delivering the right attention, to those that are in need. And apart from the working at the hospital level, they're also involved, let's not forget, in preparing the medical students at the university, so that we can, in the long run, also take over our own health system. And the way I see it is that they are not only helping us, giving us fish, but they are also teaching us how to fish.
Products of the Cuba-Gambia bilateral cooperation are extremely clear on the objectives of the cooperation, which perhaps puts Cuba high on the diplomatic profile of third world countries.
I'm schooled here in the medical school of the University of Gambia, and then I would say 90% of our lecturers are Cubans. So I would say because of the Cubans, that's why I'm here today as a medical doctor. So, and apart from that, from the school, we went to the hospital as a house officer. We were trained by these Cubans in all the departments, internal medicine, general surgery, pediatric and obs and gyn, and we have seen how much these people have done for this country. Absolutely, if you ask me, if I would say, I don't think there is any nation that have contributed to the health sector of the Gambia more than Cuba. Because I cannot just imagine how many surgeries are done in Banjul by the Cubans, how many surgeries are done here by the Cubans, how many patients are being seen at the emergency, the obs and gyn by the Cubans. Absolutely, every day I say we'll have at least 2 or 3 patients being operated here by either the Cubans or by the products trained by the Cubans. So that means all the surgery done here are done by the Cubans, because if they don't do it directly, it's going to be done by somebody who were trained by them. So we cannot just overemphasize how these Cubans have contributed to the health sector of the Gambia. So if you go to all the other hospitals, all the clinics from here across the country, you'll find at least one Cuban. So I will summary say that then we cannot overemphasize the importance of this team in the country.
I am a product of this relationship. Since the beginning of the relationship, His Excellency the President, who is the President of Cuba, Fidel Castro Ruz, who are the founders of this relationship. This is a type of relationship we call humanity solidarity relationship, because Cuban doctors are here being posted at any part of the country, working to improve the health condition of this country. And at the same time, they are also at the medical school, producing medical doctors, so that Gambia in the very near future will be able to produce its own doctors to serve its own people. So because of these two important acts, I think this relationship is a relationship to envy with. It's a relationship of brotherly relationship between the two people.
From the first batch of 38 Cuban doctors who arrived in Banjul in 1996, the RVTH alone has close to that number now, where Professor Franklin Perry and a host of others are giving their best daily in saving lives.
I am Professor Franklin Kirkham Perry Barrett from Cuba. I am consultant pathologist, a second degree specialist, and I am here in the Gambia working in a mission for 2 years. We are fulfilling the outcome of these professionals that have been here in the Gambia for over 20 years now. So I am the pathologist that is now in this region, and we are fulfilling all pathological work. That means our work is biopsy, fine needle aspiration. Our work also includes cytology, both fine needle and pap smear, and also autopsy services. We here have a very outstanding line and plenty of work here in the Gambia, because it's very important for us to recall there are significant diseases that we don't see in our country, and we have to diagnose this here. And also we have plenty tumors in different aspects in this country. And then with our diagnosis, we can take conduct that will be able to save the person's life.
My experience in Gambia is very rich. They are very friendly people, and we have a very good relationships. Okay, if I go to Farafeni town, every people in the town greet Dr. Miguel, and Dr. Miguel greet the people. It means that the relationship between Gambians and Cubans are high appreciated, and that the Gambian people appreciate very highly our services in this country.
My name is Sandra Hernandez Labrada, Cuban nephrologist. And hemodialysis units started in the Gambia in 2006 with 2 dialysis machines. Now we come of a total of 13 machines with 2 nephrologists specialists, 1 Cuban and the other is Gambian but Cuban training. We have 2 Cuban dialysis nurses and 1 biomed engineer. The service of the biomed engineers has saved the Gambia millions of dialysis in the reparation of the machine. Dialysis treatment is free for all the patients. And I would like to extend our sincere gratitude to the government, Gambian government, especially to the President of the Gambia for giving us the possibility to work in this country for 20 years.
I'm very happy with the coordinated relationship and the way I work with. Definitely, I would say it's a tremendous effort, and I enjoy working with them. They are hardworking. Personally, myself, they taught me a lot of new skills that I have never learned in the school or with my boss. They create a new system for the country. If you look at the world, you see that we are working by their new system.
The Cubans are also focused on training Gambians at the medical school in Banjul.
Definitely, they have tried so well. They will go all out to make sure that they prepare to come and deliver, which is not easy. Medical program is not easy. If somebody is to go and prepare for you to give you what you need in the medical program, it's definitely appreciated and a job well done. Since all our professors except one are Cuban professors, that is our second year program, they have definitely, it is not easy with us, medical program is not easy, but when you, after going through their assessment, for example, their lectures and assessment, and you re-evaluate yourself, you realize that you've got a lot from them. Yes, definitely. I pray that the bilateral relationship, is even strengthened beyond this level.
We are teaching medical and nursing and public health students. This collaboration began in 1999, the 4th of October. Since that, we have been teaching for 17 years here at the Gambia. We have, in this moment, 56 students of the second year, because the first year is pre-med studies. We have also 38 students for third year. After that, they will have the professional exam part 1, and they will go to the second period, to the medicine and therapeutic department at the Edward Francis Small Teaching Hospital.
Elsewhere in the metropolis of Brikama, the successful medical cooperation between Banjul and Havana have also had great impact in the sprawling settlement.
In terms of orthopedic surgeons, I would really love that area to be really looked at with regards to the government of the day and also through the Ministry of Health and Social Welfare. If we have a very good consultancy in terms of orthopedic surgeons, that will be of great help. The Cuban team, since inception of their stay in the Gambia, we've achieved tremendous achievements with regards to the health sector. Then when they are here, we have very limited Gambian-based doctors, of which obviously their contribution towards the health of the Gambian people and non-alike is immense. It cannot be countable. They've improved the health status of Gambians and non-Gambians, and also have transferred knowledge to our own very people at the School of Medicine and also at the School of Nursing, where they've been conducting lectures.
Cuba has medical doctors in nearly 101 countries across the globe.